Today on the Soul of Black Maternal Health, high blood pressure in pregnancy is not just a number, it's a warning, a call to action, and a leading factor in maternal complications and deaths. Did you know hypertensive disorders now affect nearly 1 in 7 delivery hospitalizations in the U.S. and more than 1 in 5 Black birthing mothers? In Spokane, Washington, and across the state, maternal deaths from preventable causes remain a critical concern. Join us as we speak, observe, understand, and lead the way towards safer pregnancies for Black mothers and families. Welcome to a special podcast series created in honor of Black Maternal Health Week, hosted by the Shades of Motherhood Network. I'm Dr. Akesia McMillan, Integrative Women's Health Expert. This week and this series exists to center the voices, leadership, and lived experiences of Black mothers while advancing community-led solutions that promote healing, trust, and collaboration. Across the United States, Black women continue to face significant disparities in maternal health outcomes. And while these disparities are real and urgent, so too is the strength within our communities, where we hold powerful traditions of resilience, advocacy, and collective care. That's why this year's theme centers around the SOUL framework: speak, observe, understand, and lead. These conversations are about awareness, it's about empowerment, and it's about change. Because when Black mothers are supported, informed, and heard, families thrive, communities grow stronger, and generations are protected. Today we use the SOUL framework: speak, observe, understand, and lead. Let's begin. Across the United States, Black women continue to face significant disparities in mental health outcomes. For example, nationally, hypertensive disorders now affect nearly 1 in 7 delivery hospitalizations, with over 20% of Black women affected. In Washington state, the Maternal Mortality Review Panel reports that pregnancy-related deaths peaked in 2021 through 2022, and more than 80% of those deaths were preventable. These numbers remind us that vigilance, awareness, and advocacy can save lives. Speak, raising your voice about hypertension. Hypertension can take several forms during pregnancy. Chronic hypertension, which is high blood pressure before pregnancy or before the 20th week. Gestational hypertension, which develops after the 20th week of pregnancy. And preeclampsia, which is high blood pressure combined with organ damage, potentially life-threatening. National research shows Black women are more than twice as likely as white women to develop hypertensive disorders during pregnancy. High blood pressure during pregnancy can lead to stroke, organ damage, preterm birth, and maternal death. CDC data reports that hypertensive disorders contribute to nearly 1/3 of maternal deaths at delivery hospitals in the U.S. Here in Washington state, including Spokane, maternal deaths remain a public health concern, particularly for Black women, highlighting the need for awareness, prevention, and advocacy. Speaking about these conditions openly allows women and families to replace fear with knowledge, creating space for life-saving conversations. Think about your own community or circle of mothers. Who might benefit from hearing today's conversation? The next step in the SOUL framework is observe, listening to your body. Pregnancy requires close attention to the signals our bodies are sending. Symptoms of hypertension and preeclampsia may include persistent headaches, swelling in the face or hands, changes in vision, blurry or light sensitivity, upper abdominal pain, or sudden weight gain. Observation also includes attending all prenatal visits, tracking your blood pressure at home, and maintaining a pregnancy health journal. Early recognition saves lives. In fact, maternal mortality review boards in Washington report that many deaths are linked to delayed recognition of warning signs. Observation isn't just personal, it can also involve your support system. Partners, family, and friends can help identify changes in symptoms and encourage timely medical care. Understand the why behind hypertension. Understanding means recognizing the biological, social, and systemic factors contributing to hypertension in pregnancy. Chronic stress and systemic inequities increase risk for Black mothers. Limited access to prenatal care and healthy foods can compound risks. Healthcare disparities often result in delayed treatment. Prevention strategies include stress management techniques, mindfulness, gentle exercise, or counseling, balanced nutrition and proper hydration, prenatal safe physical activities, adequate rest, and open communication with healthcare providers. National studies show that nearly 80% of pregnancy-related deaths are preventable with early recognition and treatment. Understanding empowers women to take proactive steps, advocate for their care, and recognize when urgent intervention is needed. Lead, advocacy, and community action. Leadership begins with knowledge and self-advocacy. Ask questions during appointments, track your symptoms, and share concerns. Seek second opinions if necessary. Leadership also happens in the community. Sharing knowledge with other mothers, supporting culturally grounded organizations like the Shades of Motherhood Network, advocating for systemic changes in maternal health care. Leadership is about creating healthier pregnancies, safer communities, and stronger futures. As we close, remember the SOUL framework. Speak. Create space for truth and lived experiences. Observe. Pay attention to your body and community. Understand. Learn from science, culture, and lived experience. And lead. Act on knowledge to protect yourself and others. High blood pressure in pregnancy is serious, but knowledge, vigilance, and advocacy can change outcomes. Together, we can support Black mothers, protect families, and strengthen communities. Because when Black mothers thrive, generations thrive. Thank you for joining the Soul of Black Maternal Health, brought to you by the Shades of Motherhood Network. For more insight on Black maternal health, visit theshadesofmotherhoodnetwork.org.